Today, we are very fortunate to have several options for the treatment of newly diagnosed chronic phase chronic myeloid leukemia. There is 3 agents approved from frontline. One is imatinib, the second one is nilotinib, and the third one is dasatinib. When we really discuss with our patient initial therapy for treatment of chronic phase chronic myeloid leukemia, it's very important to really have the feedback of our patient in terms of dosing, as well as to really take into consideration any potential comorbid condition the patient may experience or have experienced before, as these may predispose to really have complications to specific drugs that we're going to really prescribe. So it's important to take into consideration the past medical history of the patients that we really start or we decide to change therapy with a tyrosine kinase inhibitor. In this case, the patient has history of long QTc, has also history of chronic kidney disease, as well history of lung cancer, treated with surgery, but also complicated by pleural effusion and thoracentesis. In this regard, all these comorbid conditions may really make us choose certain drugs or preferentially certain drugs versus others, at least considering that some of the drugs that we are currently used for the treatment of chronic myeloid leukemia may really have complications such as pleural effusion, prolonged QTc, or even they may, in the long run, in some cases, potentially decrease glomerular filtration. The treatment of chronic myeloid leukemia in older patients is maybe challenging, and this is because the multiple comorbid condition that is very well studied, that most of the patients with CML after 60, 65-year-old presenting, as well as many times the polypharmacy that these patients are receiving. This is very important factors at the time to consider which TKI may be better tolerated, but also very important as predictor of potential side effects of each of the drugs that we are going to prescribe. The patient in this case was treated with imatinib, although we know that imatinib is a good drug for the treatment of frontline patients with chronic myeloid leukemia. We also know that in 2 trials that has performed and compared imatinib with second-generation TKI, one of the advantages to really treat patients with high risk so-called score is that they have less progression during the first year and they achieve faster and deeper response. In this case, although no one can say that is contraindicated, the decision to really use a second-generation TKI should be discussed with the patient because may have some advantage in terms of better response during this first year. In any patient that we decide to start treatment with any tyrosine kinase inhibitor, it's important also to take into consideration all these comorbid conditions. So very important to really control any abnormalities and any other comorbidities that can really increase the toxicity of the drugs that we're going to really prescribe. In this case, it's important to really have a close collaboration with the primary physician, even with cardiologists, to really work as a team and to try to avoid comorbid condition can affect the toxicity of the drugs that we're going to prescribe.